It's a black hole.
She's hallucinating.
I got enough problems already.
Her subconscious is trying to tell her something. We need to eavesdrop.
It's surprising House isn't religious since he's performed multiple miracles up until this point. Very excited to be reacting to House MD Season 6 Episode 16 Black Hole. On this channel we are reacting to all 177 House episodes and this will be episode 127. Let's see if I can get the diagnosis before House does as a doctor working in London.
It's estimated the observable universe is 93 billion light years across.
I don't want to break up.
Stanford's on the other side of the country.
Abby, you know you're not supposed to have any food or drinks in here.
Oh, it's just water.
I never knew you were such a good liar.
Well, a little more vodka and you might find out some more things you didn't know about me.
What are you looking at? Abby? Oh my God, something's wrong. She's not breathing.
Call 911.
Would you mind at least putting a napkin under your jelly toast?
Get a table and I won't eat on the couch. You've never furnished a home. You're afraid. Your furnishings all defines you. Buy some furniture or admit that you're empty inside.
X-rays confirmed the fluid that almost suffocated her to death was from pulmonary edema.
Princeton Plainsboro definitely wasn't the pee-pee she was planning to see after class. So bad. Either way, we know that she was drinking booze, had some frothing in the lungs, and was completely unresponsive during that episode. I have to be honest, from an accuracy perspective here, when someone's lungs are filling up with fluid, they definitely do not look as calm as this lady. Their heart rate goes up massively, and so does their breathing rate as they panic, while every breath feels like it's being taken with your head underwater. So either that's just a missed accuracy point or she had some kind of seizure at the same time that led to that. Historically, it served me better to just go with what the team says rather than what I noticed. So let's focus on the fluid in the lungs and assume that it's that. What can do that? Well, the common cause here would be heart failure, but House loves common, like dolphins love tutus. So what else could it be? Well, it could be kidney failure, a blood transfusion reaction, or maybe she hiked up Everest that day. They could all potentially do it. They seemed to be into astronomy. Maybe they spent too long outside looking at stars through a telescope and ended up with a tick bite. It could potentially do it through Lyme disease, Rocky Mountain spotted fever, tularemia, or even ehrlichiosis. Oh, that would fit perfectly, but which one could it be? Let's get more clues.
When an American schoolgirl has 2 drinks before 10 a.m., it's a pretty sure bet that the plan is to have a lot more.
We're arguing over the fact that we don't ever do anything together anymore.
We don't ever do anything together?
And besides sleeping, watching TV, going out to dinner, what do we do together?
All right, I'll do the yoga.
I'm fine. Please, just go.
Where's Abby Nash? She okay?
We think her drinking may have damaged her heart.
She doesn't drink, not that much.
What is that?
Could be a fungus.
No parasites, no fungus.
Transesophageal echo could give us a better idea of what we're looking at.
Echo could trigger a heart attack.
It was the heart, but we still don't know what's in it. Looking closer at the image, it seems to be a CT scan with a slice there and a dark spot right on where the mitral valve should be between the left atrium and ventricle. They mentioned it isn't fungal or parasitic and could be bacterial, viral, or even autoimmune. So what could that be? Well, if there were growth on the valve, it would be called a vegetation and what is known as endocarditis. People can get it through various methods like having tattoos, bad teeth, injecting drugs in the vein, or like one of my patients as a free add-on to a turkey hair transplant. Those usually are in the form of bacterial endocarditis though, which for a condition that causes fever is unironically not that spicy. There is though an incredibly spicy type of vegetation formation called aseptic endocarditis, which I would suspect based on her naturally thick locks. No trips to Turkey there. Oh, I have a theory. We already know that our schoolgirl likely isn't a stranger to a game of tonsil hockey, and while kissing could have picked up a throat infection. That led to an autoimmune reaction called rheumatic fever, which sets the immune system wild on the valve. That could lead to a black spot and lung problem without them ever finding bacteria inside that valve vegetation. That would work really well here, so I'm going for rheumatic fever as my first diagnostic guess. Also, why is House so obsessed with furniture this episode? There's always a reason.
My guess is she thinks you don't want to spend time with her because you're spending it with someone else. There's the heart.
Valves look fine, no vegetations, no myxomatous changes. She's ruptured. Get the scope out.
Her BP's normal and her heart rate was controlled.
No leakage from cannulation site. Charging. And go. It's not working. Clear.
Normal sinus rhythm.
The dissection means we were wrong about alcohol causing a hypertensive crisis.
What about an allergy?
If it was an allergy, she'd be getting better in the hospital, not worse.
Unless it was inside her.
You want my sperm? I use a condom.
For everything?
For most everything.
I'm placing a drop of Nick's semen protein onto the skin. Check for a rash in an hour or so.
My stomach.
Blood in the urine.
No allergic reaction. We could do a full body scan.
We hate full body scans.
We also hate when a patient dies before we figure out what's wrong with them.
Do the scan.
Even putting sperm on the skin isn't as surprising as House agreeing to a full body scan. That is desperate. Many of my patients ask for this exact scan and believe we don't give it because we're being cheap. The real reason that we don't want to do it is incidental omas. Telling someone they have a small mass in their body that may potentially kill them is an exceptionally worrying situation, but if we do these full body scans, on average we find 3 masses in each of us that are of absolutely no consequence. That means we need further investigations and the associated side effects and risks when the person could have lived normally without us ever knowing about these things. This patient definitely won't live normally again though if we don't find out why she's now bleeding into her urine. We now know that the higher detailed scans showed the heart is actually fine, so either the first scan was wrong or whatever was there has disappeared. Let's assume it was just a red herring, then that means we have lungs and kidney. Metabolic could be from high urea levels, but that's not that spicy. Infectious could be leptospirosis caused by bacteria she could have gotten from contact with contaminated soil or water. Degenerative could be amyloidosis. That would actually fit quite well here, except the deposits would be in the heart, so we'd see reduced function on the ultrasound, but maybe they didn't get that far. Neoplastic could be multiple myeloma, but wrong demographic again. Inflammatory could be granulomatosis with polyangiitis, which can present like this, although it would usually be a bleed in the lungs rather than just fluid. Toxic, potentially chlorine gas exposure. None of those are really jumping out to me, except possibly leptospirosis. The same rationale as before with the tick bite. They were outside with the telescope, but they were exposed to dirty soil instead of the bite. Definitely still need more clues.
How can you convince someone you're not cheating on them?
Take them with you wherever you go for 24 hours a day. So your wife's a little insecure. Is that so bad?
What do you think?
You work quickly.
I think there's something wrong with the machine.
It's not the machine. It's an earthquake.
It's a black hole.
She's hallucinating.
I got enough problems already.
Her subconscious is trying to tell her something. We need to eavesdrop.
It's surprising House isn't religious since he's performed multiple miracles up until this point, plausibly explaining an immaculate conception, even though it was to hide. Curing Foreman by infecting him with a deadly condition, and now it seems like he's having a light bulb moment for telepathy. In all fairness, there is an old saying from Arthur C. Clarke that any sufficiently advanced technology is indistinguishable from magic, and that isn't just for TV shows. In 2024 alone, we've seen Neuralink implanting their first brain chip into a human subject, an AI brain decoder that can recreate what you're looking at, and a song being able to be replayed just from functional MRI images. What will be possible in 2025, 2030, or 2050? Maybe they'll actually build technology that prevents the US president from calling Zelensky Putin.
Ladies and gentlemen, President Putin. President Putin. He's going to beat President Putin. President Zelensky.
But our patient will sadly not live to see the world exterminate itself if we don't figure out what's wrong with her. We're not just getting the symptoms now though, we've also got House's puzzle. He said that maybe her subconscious is telling us something. She keeps visualizing black holes. This episode is called Black Hole, and we saw one in her heart. Now I'm sure the puzzle will be more complex than just a hole in the heart. That's especially true because it would have been picked up by the echo otherwise, and it wasn't. So what else could all this black hole business be? Usually these things could be a two-step reasoning type puzzle. A black hole is an area of such powerful gravitational pull that not even light can escape from it. We also know that they can form from dead stars. Wait. What if that's it? We're not looking at the heart to see the black hole. We should be seeing what was there before it formed. That's surely the clue. The black spot used to be a white spot, which would have indicated something else. Oh, Okay, I have a theory. Abnormal proteins are building up around her body, causing these black holes to form because of those deposits. These can be accumulating tissue damage, leading to the black spots. Cardiac amyloidosis could actually explain her symptoms, as it would affect pretty much any organ in the body. They could potentially treat with chemotherapy or meds to reduce amyloid buildup, depending on the type she has, but that usually doesn't cause just such localized lesions like this. Still need more clues.
The cognitive pattern recognition program might tell us what's going on in her head.
Get an MRA with contrast to see if she has an aneurysm. Unless you think Cuddy's gonna go for the mind reading.
Do the MRA.
What did you do with the furniture?
I returned it. We get it done so you don't have to. Step inside one furniture store and find one thing you like.
Abby, anything I can do?
Just don't go.
We have a secret.
Abby, I want to marry you.
Your secret is killing you. You deserve to die.
We need 4 milligrams of lorazepam.
She seized for over a minute. She claimed she emerged from her body as a younger version of herself and started talking.
Even if we can get the equipment, it takes hours for the initial mapping.
Once the computer maps how she processes the information, use the same equipment to monitor her unconscious thoughts. Hopefully, it'll spit out a very basic video of whatever's going on in her head.
The team think House is a madman trying to make magic by doing this, but he's gone ahead and predicted the future. The exact experimental tech that they're working with here is alive and functioning in this very day, almost 15 years after this series was even filmed. Madness. This isn't the first time the writers have gotten it right either. Like the 1968 movie called 2001: A Space Odyssey that predicted how the Earth looked from the moon and the flat screen devices astronauts would use, as well as a voice activated AI called AL 9000 which could turn lights on and lock doors just like Google Home or Alexa. So cool. Alexa probably won't solve this one for us though, and now we know the patient's having seizures. That does actually make amyloidosis way less likely, as the brain is protected by a series of tightly connected blood vessel junctions called the blood-brain barrier that stops uninvited guests from taking hold. So what else could this be? Okay, I've got a serious theory now. We know the patient is sexually active and she says she has a secret that's killing her. She's seeing a young girl, they're talking about a black hole. What if the black hole is an infant who's sucking her mother's resources but not in the right place? Maybe it's an ectopic pregnancy somewhere. They didn't manage to finish the full body scan. Maybe they could have missed it. Or her symptoms could be explained by something called eclampsia, where you get kidney damage, retained fluid, and it can cause seizures. Maybe that black hole in the heart was one of the fetuses that didn't survive and there's a live one elsewhere. Or eclampsia from pregnancy has to be my second diagnostic guess. Let's see if I'm right.
What made you think of this?
I missed you.
Car in the parking lot.
It's the first. I love you. You know that, right?
But
Got a real cool magic show about to start.
Abby, can you think of something specific?
What are you thinking?
About Nick playing baseball?
Holy crap.
I was wondering if you could tell me a little bit about this dining table.
That is a remarkable collection, if I can show it to you. I'm Gabriella. What else attracts you in the patio section?
Wait, this is a patio table?
She likes school and she has daddy issues, neither of which helps us.
Pineal gland is calcified. What if it's obscuring a tumor?
Get a better look at her pineal gland with 3 Tesla fast spin echo MRI.
3 Tesla fast spin echo MRI? That name sounds like the child of inviting every possible investigation to an orgy. But what does it even mean? Well, a fast spin echo MRI is a type of sequence used to get better contrast in dense material like bone or bone-like substances, i.e. a calcified pineal gland. The team suspect that a tumor might be sitting behind that thing, so that's likely why House requested it. But what does the pineal gland even do, and why was it calcified? Well, it's a tiny area in our brain that receives information on how light and dark the environment is, and then releases a hormone called melatonin as a result. That controls how sleepy we are. It tends to accumulate calcium between around 5 years old and all the way up to 30 because of how metabolically active it is. Now they think it could be hiding a tumor, but does that make sense? Well, not really, because tumors of this area tend to be benign, and in all honesty, I don't see what they mean when they keep talking about obstruction, like they're playing peekaboo and the scanner is an infant. Scanners don't just look in one direction, they produce horizontal slices at different levels and can be cut in multiple planes. I mean, our degrees wouldn't be very useful if we didn't use all 360 of them. Since this tumor theory seems to be its own black hole, what do our new clues tell us? Well, we know that the patient was seeing her partner playing baseball and remembering holding hands with her dad. It was exactly in that order as well. All right, I have a theory. Oh, I so hope this isn't just confirmation bias. She saw her partner first and then her dad because her partner is becoming a dad. It just seems like the perfect secret and would explain everything with this eclampsia diagnosis. Does the playing baseball have any significance though, or the holding hands with her dad? Could it be somehow talking about hitting a home run? Who knows? Let's get more clues.
You know what says even more about who you are than your furniture? The fact that you are letting House tell you how to buy furniture.
MRI revealed no remarkable features on her pineal gland.
Yet she's still failing system after system.
I'm not having an affair.
Or is it because you now really are old enough to be there? The dad.
No, I just realized what House just realized, and it's not pretty. They said she had daddy issues during the scan. Foreman just said that her LDH levels were too high and she keeps getting worse. Well, why? Well, she does have a semen allergy, but not to the one they tested. She didn't have a reaction to the boyfriend because she's actually sleeping with his dad. They didn't treat for allergy because they couldn't find a source, so if they just test him, then they'll finally confirm it. Remember at the start when she was telling her boyfriend that Stanford's so far away? Well, this is the reason why she wanted to break up. Her real eyes were on a more aged prize. Semen allergy to the father's wandering swimmers has to be my third and final diagnostic guess. We are locked in.
Does he travel for work?
He died almost 10 years ago.
Not hers, her boyfriend's. I'm your son's girlfriend's doctor. I think you exposed her to a parasite. My theory is that her body was able to kill off the parasite, set off an allergic reaction called cerebellar schistosomiasis delayed hypersensitivity allergy. Only thing is, did you ever have sex with your son's girlfriend? The only way she could have been exposed to this parasite is sexually. Choose between her living and the truth becoming public.
You'd broken up.
She's allergic to the Egyptian parasite swimming around in your dad's semen. Technically, she was legal. Wait. It's actually great news. Decorator didn't pick this. I like what this says about you, Wilson.
Marry me.
We're already married.
I want to be better at it.
What'd you tell him?
That it doesn't mean she doesn't love him.
She did have an allergy to the dad's sperm. Got it with the last one, but that's a bittersweet victory. How am I becoming cynical enough to get these? But I didn't quite hit the parasite aspect of it because, to be honest, it doesn't really happen. Schistosomiasis isn't sexually transmitted, and only 1 or 2 cases ever have described it being present in the sperm. Also, how is Tao proposing again to his wife and then going off with another woman? What kind of otherworldly mutant testosterone is fueling this man? He just doesn't stop. Did he not learn enough from the first affair that literally destroyed his plastic surgery career? In all fairness, he's probably happy about that, as it was the tailwind that he glided on into House's not so sweet embrace. Great episode, loved the puzzle here. So it's 7.8 out of 10 entertainment, 7 out of 10 accuracy because of the sperm parasite situation and the fact that her breathing was so comfortable when her lungs were filling up with fluid, and 8.1 out of 10 diagnosis. This episode doesn't make full sense until you watch a previous one where a woman's whole life is the internet's business.